Ryan, this is Patricia.
Hello, Patricia.
Hi. Are you going to be giving us some instructions? Because there's nothing in the chat.
Yes, I will be giving instructions, and once we start the meeting, I will put in the chat the order that will introduce yourselves and the questions that you'll be asking in order.
Okay, thank you.
Yep. We can't do it in advance because we're not sure who's going to be attending from the board.
Well, this is Harold Byers. And
Hi, Harold.
Good afternoon.
He's on the phone. I will tell him hello for you though.
Good afternoon, Andre.
How's everyone today?
Good. Did you enjoy your Memorial Day?
I did a lot of yard work.
Oh, I wanted to, but it was, I don't know about you, but it was really windy and kind of drizzly, and it wasn't calling my name.
No, I wouldn't say it was fun.
I didn't do
Necessary.
yard work, but I did housework instead. We're getting ready for ball players to come in, so.
Oh, that's exciting.
And I wanted-
I'm glad that you're
Andre
hosting.
and me too. Andre and Ryan, we just got a call this morning that my husband's brother passed away in Hood River this morning.
Oh.
So I'm not sure when we'll be leaving town. I will let you know if I need to miss some of the interviews.
Well, I'm so sorry for
Thank you.
your loss. That's terrible news. And if there's
Yeah.
anything we can do to help in any way, we'd be happy to.
Thank you. I appreciate that.
Oh, that's terrible.
Very sorry, Patricia.
Yeah, thanks, Amanda.
Ryan, this is Ron. Commissioner Lindy is on his way home, and he should be arriving anytime, but he might be a few minutes late.
Okay.
Thank you. Good afternoon, Commissioner.
Take a moment to get myself some water here.
It's 3 o'clock right now. Do we want to start, or do we want to wait a couple minutes?
Yep, we do have a recording, so everyone will be able to watch the video. And I know
I'll go ahead and begin the meeting, and I'll call the meeting to order. And this is the May 31st, 2022 interviews of prospective board candidates for the Yakima County, Yakima Health Board. And I will ask Mr. Ryan to do a roll call and introduction of guests.
Okay. All right. So Commissioner Anderson,
Here.
Dr. Clary, Commissioner McKinney. Commissioner McKinney, you're on mute.
I think she went to get some water.
Oh, that's right. Okay. Commissioner McKinney is here, is present. Commissioner Lindy. Councilmember Byers,
Here.
Dr. Atterbury, and Councilmember Duval. Okay, and Commissioner McKinney, just roll call.
Present.
Okay, and Yakima Health District staff, Andre Fresco. You're on mute, Andre.
Apologies, present. Good afternoon, everyone.
Okay, and myself, Ryan Eibach, and we have Victoria Reyes from the Health District.
Present.
Okay, and then I will be introducing the candidates before we bring them on. And so, oh, and there's Commissioner Lindy. Commissioner Lindy, we're taking roll.
Here.
All right, welcome.
Thank you.
Okay.
Pardon me, Ryan, before we introduce the prospective board member, would you like to make that reminder about the questions?
Yeah, I was just waiting for Commissioner Anderson to move on to the next agenda item.
Apologies, thank you.
Yes, okay, we have some unfinished business here. The Board of Health citizen representative candidates are interviews, and Mr. Eibach will outline that, the strategic goal of that. And if you would proceed with that, I'd appreciate it.
Okay, we do have 3 candidates that we're interviewing today. So we'll be interviewing Daleen Ackerman at 3 o'clock. So she'll be the first one, and she's for the Consumer of Public Health position. At 4 o'clock, we'll be interviewing Katrina Henkel. She is interviewing for both positions, the Consumer of Public Health and the other stakeholder position. And then at 5 o'clock, we're scheduled to interview Kathryn Bambrick, who is running for the other stakeholder position. We do have 11 standard questions that will be asked. All board members do have the 11 questions. Follow-up questions may be asked if necessary to understand the applicant's response to the standard question. The introductions of the questions will be in the following order. And if Victoria, if you can put this in the chat box in the order that we'll do introductions first, and that will go with Commissioner Anderson, and then we'll go Council Member Byers, and then Commissioner McKinney, and then Commissioner Lindy. And then as far as questions go, we'll just go in that same order. So we'll go, Commissioner Anderson will ask question number 1, number 4. I'm sorry. Number 1, 5, and 9. Commissioner Anderson, 1, 5, and 9.
Okay.
Councilmember Byers, you'll be question number 2 and 6. Commissioner McKinney, you'll be question number 3 and 7. And Commissioner Lindy, you'll ask number 4 and 8.
Thank you, Brian.
Yep. Again, these interviews are being recorded, and so at the end of all the interviews on Friday morning, the link to watch the videos will be sent out to all board members so they can watch them and for decisions on our special board meeting on June 9th.
Okay.
So does everyone have the questions?
I do.
Okay.
I am looking for mine. I had it open and I accidentally closed it out, so I'm going back to my.
What we'll go ahead and do is if when you introduce yourself, what your position on the Board of Health is. So obviously commissioners will introduce themselves as commissioners. Council Member Byers, you'll introduce yourself as a citizen member. I mean, as a city member.
Okay,
Okay.
are we ready?
And then Victoria, you're gonna put Council Member Byers will be question 2 and 6. There you go. And then Commissioner McKinney will be 3 and 7. And Commissioner Lindy will be 4 and 8. All right, any questions before we bring on Daleen Ackerman?
No.
I'll just ask if Victoria could send them. I have all these emails from her open and I had it open in a separate page and accidentally closed it. So Victoria, would you mind emailing me just the questions? That way it's at the top of my inbox, please. And I know you already sent it, so I apologize.
I just sent that now.
Thank you very much.
Okay, all right, so let's bring Daleen Ackerman on. Hello, Daleen.
Hi there. How are you?
So we can hear you, but we can't see you.
Okay, hang on.
Okay. All right.
There you go.
Came
Oops,
up.
All right.
got you.
Thank you for joining us this afternoon.
Yeah, thank you for having me.
So I'm Ryan Eibach. I'm the Chief Operating Officer at the Yakima Health District.
Oh, okay.
What we'll do is we'll go around the room and introduce ourselves, and then afterwards you can introduce yourself and tell us a little bit about yourself. And then we have 11 questions to ask you. And then afterwards, if you have any questions for the board, then please feel free to ask any questions. You applied for the Consumer Public Health position. And so we'll go ahead and start with our chair, Commissioner Anderson. Can you introduce
Good
yourself?
afternoon, Daleen. Welcome and thank you for your application. My name is Ron Anderson. I'm a County Commissioner, District 2.
Yeah, nice to meet you over Zoom.
Hi, Daleen. I'm Patricia Byers. I serve on the City Council of Yakima, and therefore I'm a city representative on the Board of Health. Welcome.
Thank you.
Hi, Daleen. My name is Amanda McKinney, and I'm Yakima County Commissioner for District 1. And I also am grateful that you wanted to be a part of this group, and it's wonderful to meet you by Zoom.
Thank you. Nice to meet you.
And good afternoon, Daleen. My name is LaDon Lindy, and I'm Yakima County Commissioner from District 3. Nice to meet you, although I would have preferred to meet you in person. It's still good to see you here, and appreciate your interest in the Health Board position.
Yeah, thank you.
Okay, and we do have two staff from the Yakima Health District. So Andre and then Victoria, would you like to introduce yourselves?
Yes, good afternoon. I'm Andre Fresco, the Executive Director here at the Yakima Health District, and we're grateful for your interest on being on our board.
Okay, nice to meet you.
Pleasure.
Hi, Daleen. My name is Victoria Reyes, and I'm the Administrative Assistant here at the Yakima Health District.
Hello.
All right. Would you like to tell us a little bit about yourself?
Well, I actually was born and raised here in the Valley, and so pretty tied to the area and a lot of family friends, and so I have a stake in the health and well-being of the community. I have 3 kids, 4 grandkids, and just recently retired, and so just wanted to kind of get involved in my community in a meaningful way.
Okay. All right. Well, thank you very much. So Commissioner Anderson will ask the first question, and Daleen, you did receive the questions in advance, is that correct?
Yes.
Yes, ma'am. Okay, perfect.
And Commissioner McKinney, did you receive the questions?
I think you're on mute, Commissioner McKinney.
Hot off the presses, yes. So
Okay,
thank you,
good.
Victoria.
All right, I want to make sure before we started. All right, I'm going to be asking you the first question here. Please share with us what you know about the Yakima Health District and what makes the mission of the Yakima Health District meaningful to you.
Well, I guess what I know about is that oversees the health issues of the community. So things like clean water, sanitation, food safety, communicable disease issues, and I guess what makes that meaningful to me is I think all those things are very important to the general health and well-being of a community, and have been shown to keep disease down and from spreading. And so I think they're important issues.
Thank you.
So Daleen, I'll be asking you the second question. In your opinion, what is the public health? What is the role of the Board of Health member, and why are you interested in being on the board?
So again, I think public health is looking at what could be the potential issues in causing ill health or the spread of disease, and keeping those things at bay, trying to keep the community clean and safe and healthy. And I think as a board member, it's to look at what the issues are or potential issues may be. That would be ideal in trying to prevent an issue before it even becomes a problem. And any issues that come up, and working with each other in the community and businesses to try and keep things as safe as possible. And again, my interest is just deciding that I haven't really been as engaged as I should have been for a lot of years in government and the process of our community. So I wanted to participate in that and try and make a contribution.
Thank you.
And who has question number 3?
I do. I guess I write a little slower than everybody else. So I'll be asking the third question, Daleen. What are some of your board leadership experiences, and what experiences do you have in following bylaws, statutory rules, and regulations?
I really don't have a lot of experience as far as being on boards and things. Probably I was involved in a local chapter of critical care nurses. And so as far as, you know, being familiar with like rules of order and having a quorum to vote on things, we did follow that. And so there was a little bit of that. And as far as regulations and things, probably my experience with that comes from working in the hospitals my whole career. And so being involved in, you know, we had to deal with accrediting entities and knowing what, you know, regulations and how we need to comply with those and respond to issues that they found. So that's probably the main things.
Thank you.
Thank you.
All right, Daleen, I've got question number 4 for you. Walk us through the first 3 things you would do if you became a board member.
Well, really, I think the primary thing would be to educate myself on, you know, just getting familiar with the other board members, the process, what issues you guys have currently are discussing, working on, and then, you know, getting the information I need to then jump in and participate with that.
Great, thank you.
All right, back to me. I have question number 5. It's what can you bring to the Board of Health, the Yakima Health District, and the community to make it better?
I think my healthcare experience working in healthcare could be a valuable asset. And then I tend to be somewhat analytical. I like a lot of information. So looking at things from all sides and trying to see the other side of issues. And I've always worked well with people, get along well with people. I'm a good listener. I really make an effort to understand, you know, somebody else's point of view.
Okay, thank you.
Okay, Daleen, back to me. I have the next question.
All right.
What ideas do you have to make the Yakima Health District more effective and efficient?
Well, this one it's kind of a tough one, is because I think I need to know more about the process and where you guys are at and how you go about things. I mean, I don't necessarily think that it's inefficient, although reality is things typically can always be improved. So yeah, I don't have any specific ideas, I guess, until I get involved and find out how things work.
It's okay. Thank you.
All right, back to me. On behalf of the Board of Health and the Yakima Health District, how will you build relationships and partnerships now and in the future?
I think in building relationships, it's really about being willing to have an open mind, engaging in conversation, listening well, and having a mutual respect for people that you're talking to and working with, and really just making an effort not to be too dogmatic or judgmental, and to be willing to have an exchange of ideas. And I think one of the most important things is just realize that it's okay to disagree, that we can still work together, and we don't have to agree on everything to accomplish things.
Thank you.
All right, question number 8. Since this is a citizen representative position, how would you represent the citizens of Yakima County?
Well, I would, once I kind of learn the process, or, how things work, I'd really try and just be available to interact with the community, to either reach out where necessary, or where the opportunity exists, and listening to what people's concerns are, listening to what issues are brought, and really, again, just listening, mutual respect, trying to just, validate their concerns and see what we can do to work together.
Great, thank you.
Mhm.
Question number 9. What public health issues in the Yakima County are you most interested in? And what is your vision for the health of the community?
I think, as I said, I think the clean water, sanitation, those always have to stay at the forefront, because they're just basic things, but they can be kind of, fall through the cracks sometimes if we're not diligent. So beyond that, a big thing for me, a big interest I've always had is nutrition and the role it plays in health. And so I'd really like to see, more of an emphasis on that, and whether it be information campaigns and engaging, of course, I think the younger you can engage somebody in that conversation and buy into it. So being involved with the schools and dealing with that. Something I read an article recently talking about biosolids being used for fertilizer. So that kind of piqued my interest. And so I was kind of like, look into that in our area. I don't know if, that's being done here or whatever, but might be something to look into, I thought.
Okay, thank you.
Then Councilmember Byers, and you'll have question number 10.
I will. Okay, thank you. All right, Daleen, I have the last question, I guess. Do you have any conflicts of interest or conflicting commitments that would prevent you from being a member of the board, voting on certain issues, or attending regular scheduled board meetings?
Not that I know of. I did see that it said something about not holding an elected position, and I don't know if PCOs count for that, but I recently became a PCO.
I'm
You can
really,
be a PCO.
Okay.
I think you can be. I think that's separate than an elected official.
Right.
Yeah.
Okay.
A PCO, it's okay.
Other than that,
Thank you for
I
doing that.
can't think of any conflicts. So
Okay. And our board meetings are, our regular board meetings are the last Wednesday of every month at 8:30, from 8:30 to 11:30 in the morning.
okay.
So,
Yeah, Wednesdays actually are a good day for me, so that shouldn't be an issue.
okay.
All right.
Do you
Any
have
question for us?
Yeah, I was just curious. Forgive me if the information was there. I may have forgotten or overlooked it, but just kind of why are they adding these positions? And I was just kind of curious about making it an even number of people, and what the feelings were as far as ending up in tied votes and how that may be addressed, or if you see that as an issue.
Would
I
you like
can
to
answer
review
the
that,
why.
Ms. Eibach?
I'd be happy to do that. We're expanding the health board because of a law that was passed by our state legislature, House Bill 1152. The Yakima Health Board had actually expanded its health board beyond the 3 county commissioners quite some time ago, which the original statute had the county commissioners be the health board. So we were already well on our way to expanding. And so we actually have fewer board members to add than a lot of municipalities or I guess health jurisdictions, districts. And we have a time period, which is why we're kind of moving, would you say at the speed of light, Andre, or on our best? We are legally required to expand our health board to fall in line with the statute by July of this year. And this is a great time to give credit to the staff who has worked incredibly hard to make sure that we got all of these interviews scheduled. Obviously, there was a lot of work going into just getting the notices that have gone out. So that is why, and that is the time frame to which we are aiming towards achieving so we can comply.
Okay.
Yeah, just to expand a little bit more. So currently we have 5 elected officials. We have 3 county commissioners and 2 city officials, and then we have 2 citizens. And so the requirement is that you have the same number of unelected officials than you do elected officials. And so we have to add the three additional, but one of those is has to be a tribal member, since we have the Yakima Indian Nation in our county. So there'll be a tribal member and then 2 additional citizen members that we'll be adding to make it even.
Oh, okay.
So it's statute. The legislature required that you have even number.
Okay. All right.
Let me jump in and say, this is not in response to your question, but it's adding to what Commissioner McKinney said, that our board of, not our board of health, but our health district and its employees are very dedicated, very hardworking. You'd be very hard pressed to find a better crew than what we have right here. And it just shows in everything they do to help our community. So just wanted you to know that.
No. Thank you. Yeah.
Ms. Ackerman, to answer one of your other questions, which was the question of a tiebreaker, if you have a board, it is an added complexity that is an issue that we will have to address in future meetings, and certainly is the realization that the state legislature expected to have an equal number of unelecteds with electeds.
Gotcha. Okay. All right. Yeah. I don't think I have any other questions. Do you have any other questions for me?
Well, I would just like to thank you for taking the time to meet with us and to go through this process. And thank you very much for your interest in serving.
Oh,
Yes, David, I really do appreciate that you applied for this position, and so glad you made the interview today. And I like the interest you're showing in the community. So thank you.
yeah. Thank you. Thank you guys for your service and all the hard work. I know it's hard to be an elected official, so.
Well, as long as people like you continue to retire and then decide to help us out, we're grateful. So again, eternally grateful that in your retirement, you would choose to volunteer and serve your community.
No, gosh, my pleasure.
Well, and if I could piggyback on the thoughts of others, I would, echo the sentiments. Thanks, Daleen, so much for your interest in being willing to be involved and serve. And we thank you for your time today.
Yeah, thank you guys.
Thank you. Take care.
So
Okay.
Daleen, just real quick before you leave, I just wanted to give you the timeline. So we'll be doing interviews today, tomorrow, and Thursday.
Okay.
And then at our special Board of Health meeting on June 9th, the selection of board members will be made. And then after that, the appointment by the Board of County Commissioners will happen after that. So the next step will be June 9th.
Okay. All right. Thank you.
You're welcome.
Guys, have a good afternoon.
Thank you. Have a good
Thanks.
day. Take care.
Take care.
All right. So the next one is scheduled for 4 o'clock. And so what we'll do is we'll go ahead and put up a sign, letting people know at 4 o'clock will be the next one. So we can go ahead and take a little bit of a break.
Okay.
So you're telling us this is a time to read our chicken scratch and then
Yeah.
do our reading.
I was writing pretty fast. Yeah. I hope I can read what I wrote.
Me too.
Thank you, Ryan, for that. We'll see you in a bit.
Okay,
Great.
goodbye.
Thank you.
Thank you. Council member, oh, there you go. Good.
Andre, you just need to do something about the color of your office.
The clutter?
The color.
Oh, I was going to say, it looks pretty clean to me. Yes, it is an institutional color and it's on the list. It is on the list. You're not the first person to say it. Yes, it is an interesting color.
Well, it reminds me of many years ago, you might remember this, but at least around here, it seemed like all the hospitals were this really weird green and inside, you know, and there's all of those places that got that same color was because of a salesman who was retired to the Bahamas after selling all those thousands of gallons of paint.
Well, in my defense, the paint has held up quite well. So we spend the people's money when necessary. And
Okay.
All right, so we'll go ahead and ask the questions in the same order, and Councilmember Byers, will have you also do number 10. All right, Victoria, is Katrina waiting in the room?
Yes, she is.
Okay. All right, so Katrina Henkel is the next person that we'll be interviewing, and she is under consideration for both positions, the consumer and public health position and the other stakeholder position.
I had one quick question, Ryan. I feel like when we did this before, the last question, so it would be question 11. Do you have any questions for us? We didn't score that one, but I don't see a note about that in here.
Right, yeah. So we won't score question number 11.
Okay, so I just want to make sure our score should be added up, but no score for question 11.
That is correct, yeah. So possible of 50 points for the first section and an additional 25 points for the characteristics. So total 75 points is the motion you get.
Perfect, thank you.
Okay, everyone ready to bring on Katrina?
Yep.
Okay. Good afternoon, Katrina.
Good afternoon.
So we can hear you, but we can't see you.
Just had to get my video started.
All right. Well, thank you for joining us this afternoon. So what we'll do is we'll go around the room and introduce ourselves, and then afterwards, if you want to introduce yourself, tell us a little bit about yourself. And then we do have 11 questions to ask you, and so we'll ask those 11 questions. And then if you have any questions for us, feel free to ask us any questions. I'm Ryan Eibach. I'm the Chief Operating Officer at the Yakima Health District, and we'll go to our Chair, Commissioner Anderson.
Good afternoon. I'm Ron Anderson, County Commissioner, District 2. You're on mute.
Thank you. Hi, Katrina. I'm Patricia Myers, and we know each other from Open Yakima Task Force and the Chamber of Commerce. So it's good to see you today, and thank you for applying.
Yeah.
Hi, Katrina. Amanda Mckinney, County Commissioner for District 1. We also know each other very well. You are quite busy in all things having to do with supporting our business community. So I'm very glad to see your interest in this position.
Thank you.
Good afternoon, Katrina. My name is LaDon Lindy. I'm County Commissioner for District 3, and nice to meet you, virtually at least. And we appreciate your willingness to serve on the board.
And then we do have two additional people from the Yakima Health District, and so Andre and Victoria will introduce themselves.
good afternoon, Ms. Henkel. I'm Andre Fresco. I'm the Executive Director here at the Yakima Health District, and we're really grateful that you had interest in our voluntary board position. Welcome.
Hello, I'm Victoria Reyes, and I'm the administrative assistant here.
Well, hi, everyone.
Administrative Assistant Extraordinaire.
Thank you.
I love that Commissioner McKinney gave you that extra credit. It's nice to be seen and heard. I'm Katrina Hinkle. I'm with the Sela Downtown Association. I am an ex officio member of the Greater Yakima Chamber, Sela Chamber. I helped with community days. And of course, the allergies are killing my voice, so bear with me, you guys. I am also a mortgage broker. I have 2 kids and a husband, and I just keep kind of busy, just a little.
All right. All right, thank you. And you did receive the question yesterday?
Yes.
Okay, perfect. So Commissioner Anderson will ask the first question. And oh, it looks like Councilmember Duval is joining us.
Okay, are we ready?
Yes.
The first question is share with us what you know about the Yakima Health District and what makes the mission of the health district meaningful to you.
I actually, nerves, prepared some answers. So if it looks like I'm reading, it's because I am. I read what I decided to prepare.
Okay.
If I go off the cuff, I end up forgetting things I meant to say. So the health district was founded in 1911 to increase sanitation and prevent the spread of typhoid. Today, your mission is much more robust in nature. And while it still handles sanitation on many levels, it also tracks vital statistics, provides vaccinations, tracks and addresses the spread of infectious diseases, food safety. And more recently, you guys have been pretty involved with PFAS in the water around the training base and nitrates in the lower valley. And what makes it meaningful to me, as I mentioned, I have a couple of kiddos that I'm bringing up in this community, and I want them to have a community that allows them to grow and thrive. And if we don't work today, they won't have that tomorrow.
Thank you. I'm going to wait to let's slow down just a little bit so everybody has a chance to finish their notes.
First, sorry.
No, not you, Katrina.
Okay.
Before we ask the next question.
Oh, yes, and if I may, also, Ryan, now that we have Councilmember Duval, that will change the order of the questions.
So Ryan, are you wanting to change the order this time?
No, it's okay. I'll just listen. I just let.
Okay.
Right.
I get
Okay,
you all
so-
easy, Dahlia.
Thank you, Nyla. So Councilmember
you,
Duval,
Nyla.
would you like to introduce yourself to Katrina?
Hi, Katrina. I'm sorry I'm late. I work at a school and I just hopped on. I'm here now and I'm a council member from Toppenish and I've been a board member last year. So welcome. Thank you.
You mean to say you juggle many hats like the rest of us?
Yes.
We ready to go on to the
Okay.
next question? I have the next question, Katrina.
Awesome.
So in your opinion, what is public health? What is the role of each of the board members and why are you interested in being on the board?
So public health encompasses the general physical and mental well-being of our community. It's all inclusive. It's a holistic approach for me. Working to meet the needs of our community members, staying ahead of infectious diseases and other catastrophic events that affects our community's well-being is more important now than ever. As evidence on the heels of a pandemic and with upcoming mental health and addiction crisis and homelessness. I believe the pandemic opened our eyes to several concerns throughout our community, not just COVID, for instance, mental health and addiction. And I want to keep the greater Yakima Valley a place where we can all live a healthy, meaningful lifestyle where our children can grow, learn, and thrive. As I mentioned before, it's about creating an environment that I want my kids to grow up is my big why on why I even do what I do with the STA.
Thank you, Katrina. And we're going to take a couple of minutes for people to write their responses.
Yeah, and I'm open for questions if I didn't answer something.
All right, I will slowly ask question 3.
Should I try to slowly answer?
No, it's not you. We did it to ourselves on the last one. We kind of each started asking our question before the rest of us were even done writing. So it's not you.
That's okay.
All right. What are some of the board leadership experiences and what experiences do you have following bylaws, statutory rules, and regulations?
Well, as I've mentioned, I worked in the mortgage industry for the last 18 years as a processor. And Commissioner Mckinney can attest to this. It's full of state and federal regulations, and it was my job to make sure we were holding to those, as well as industry ethical standards, which are pretty high. I've since gotten my license as an originator, and I've been originating for 2 years, and I'm continuing to hold the practice of holding myself to those standards and ethics. I mean, you have to be responsible in that industry. But then beyond that, for the last 2.5 years, I've been the executive director of the SELA Downtown Association. And the SDA is a nonprofit governed by a working board that works to make SELA a place that community members will want to come and spend their time and money, supporting our small businesses and local economy. So I'm pretty used to, staying in compliance with rules and standards and meeting guidelines. That's just something I'm used to living by in my professional world for 20 plus years.
Thank you.
Mhm.
All right. What can you bring to the Board of Health, the Yakima Health District, and the community?
Sorry, we missed question 4.
Oh, I'm sorry.
That's me. Sorry. I was just giving people time to write. So Katrina, question 4. Could you walk us through the first 3 things you would do if you became a board member?
Yeah, absolutely. I'd like to follow in step with the board and get up to speed on what's being done to currently ensure that our community and businesses are ready for another pandemic level catastrophe. What safeguards have we put in place and what can we do further? I'd like to work to address mental health and addiction in our community on a more aggressive scale. I believe this is a growing demand and will continue to be important to our community's overall well-being. And I'd like to represent our community and business owners at the table when discussions come up that will directly affect their environments and businesses and help increase transparency to our community. I've loved seeing town halls and public meetings transmitted over social media during the pandemic and even coming out of. And I'd like to see this continue so the public is free to go look and themselves to see what's transpired and not feel like there's smoke and mirrors or that it's all a big conspiracy. That's one thing that I have noticed is when public can't readily get answers, they default to answers that maybe aren't the truth.
Thanks, Katrina.
Mhm.
All right. My turn now, I guess.
Okay.
What can you bring to the Board of Health, the Yakima Health District, and the community to make them better?
Well, through my work with the SDA, I'm in touch with our business owners and community members and their concerns. And my work with the mortgage industry trained me to be a problem solver. For instance, when I heard my community was outcrying for accurate information and then starting to buy into the conspiracy theories circulating, I worked with Ryan and Sean and the health district to create bi-monthly town halls, and eventually Commissioner Mckinney joined us, which was great. We were able to provide those answers, and I feel strengthened the ties with the community by making them feel like I had a voice in a time that many didn't. And I was able to bridge some of those perceived gaps in transparency with public leadership. Sorry, my daughter's under my desk, you guys. My childcare backed out on me. So I don't know if you can hear her. Anyways, I was able to bridge some of those gaps in transparency with some of the public leadership and help ease some of the conspiracy theories. I will continue to bring concerns to the table and then report back to my community with accurate information. I really want to be that voice at the table. You know, Commissioner Mckinney has done a great job of getting out. I see her all, I'm in her district. So she does a great job of getting out and being seen and heard, but she's one person. And I get to connect with some of our community at a much deeper level because of what I do at the Sela Downtown Association. That is my job, is to connect with my community, manage volunteers, to connect with business owners, and to bring everyone together to make our community a place that people want to come so that our economy is supported. And so that really, I'm already kind of doing it, and I would love to just add this, you know, to bring this to the table. I would love to work to research how other communities have overcome issues we face and to bring new perspectives to the table and provide options for meeting our needs here in the Yakima Valley.
Thank you.
Mhm.
Looks like everybody's ready. So Katrina, I will ask the next question.
Great.
What ideas do you have to make the Yakima Health District more effective and efficient?
Well, watching the utilization of social media grow to provide information during the pandemic was great to see. I think the health district should work to post more on the services they provide. I mean, and I've seen a lot of that, but there's always room to improve. And how the community can come together to help with those needs. Volunteers often will come together if they see a need of something that they believe in. And so maybe we can utilize some of that resource to combat some of the things we have issues with in our community. I also feel like as a community, we need to focus more on mental health resources and help in making mental health as normalized as physical health, because it does affect your overall physical health and the choices we make in life. That may mean increasing education for our littles in the schools and in our community, and maybe sourcing first aid, mental health first aid courses, so folks can maybe notice, hey, that neighbor over there that usually has the immaculate lawn suddenly doesn't have that immaculate lawn. And I remember seeing somewhere that that's a great reason to go over and say, are you okay? What can I do to help you?
I like that idea. Thank you for sharing.
Mhm.
Are you done writing, Commissioner Anderson?
Yes.
Okay, all right. I believe I see everyone's heads up. Okay, heads up, 7 up. Because it's question 7. All right, on behalf of the Board of Health and the Yakima Health District, how will you build relationships and partnerships now and in the future?
Well, I'll just keep doing what I've done, but more so. I will continue to build and grow relationships that I've formed with community members, business owners, and county leadership through my day-to-day work with the STA, just as I've done over the last 2.5 years. That's a job that's never done, and there's always room to grow and build new relationships and partnerships. So I will just keep on keeping on and actively doing that, and you know, bringing that to the table with the health district, and just and seeing, you know, if there's a need and I know of a community resource that maybe could meet that need, maybe that's where we grow a partnership. But you don't know if you're not already out building those relationships.
Thank you.
Mhm.
And Nyla, I did notice that you got my heads up 7-Up joke. Does that mean that that is still something that's played in the schools during quiet time?
I could ask my daughter under my desk if she wants. I think it is.
Boy, if only we could have a little break for heads up 7-Up in the middle of some of our meetings.
Oh, man. I think the world would be a better place.
Yeah, you definitely took me back to my childhood.
Same.
All right. Question number 8, Katrina. Since this is a citizen representative position, how would you represent the citizens of Yakima County?
By listening to their concerns and feedback and bringing it to the table at board meetings where there's an opportunity to discuss those concerns. Then I'd like to go a step further, and this is kind of what I did during pandemic, is I like to go back to that person and talk to them about the question or concern they brought to me and follow up and make sure that they feel like they were seen and heard and we got an effective answer, or it's something that's on the horizon and we're already working on it. But just so they know, it's not falling on deaf ears.
Very good. Thank you.
Mhm.
Okay. Question number 9. What public health issues in the Yakima County are you most interested in, and what is your vision for the health of the community?
So I'm starting to feel a little repetitive and like there might be a theme to my answers here. So we've made it through the pandemic and now we're facing a lot of things that came up during the pandemic. So access to normalizing mental health and addiction treatment is becoming increasingly important. So, preparedness for another health crisis is important, but mental health is really at the forefront of my mind, just coming out of what we've all experienced over the last 3 years. So my vision for the health of this community is to achieve overall well-being for our community members and an environment where our children can grow and thrive. If we don't learn from our past, we're doomed to repeat it. And our children are our future. So we have to consider both of those in our daily lives.
All right. Thank you.
Mhm. Oh, you're muted.
You're muted, Patricia.
Okay, so I have a sleeping husband in the background who's snoring a little bit. So I keep muting myself. He's napping. Okay. Do you have any conflicts of interest or conflicting commitments that would prevent you from being a member of the board, voting on certain issues, or attending regular scheduled board meetings? And our regular meetings are what, Ryan, first and third?
So our regular board meetings are the last Wednesday of the month from 8:30 to 11:30. And currently we've been having special meetings on the second Thursday of the month in the evenings from 5:30 to 8:30.
That's right.
Yeah, not that I'm aware of. I don't know of any issues that would arise. I don't live in any areas where there's water issues or any sort of yeah, nothing that I do I don't think would really conflict. I just really want to be at the table and be a part of those conversations and just kind of help look out for our community. So yeah, I don't think so. I don't think there's any issues, and I'm pretty sure that I can make all those meetings.
Thank you, Katrina.
Mhm.
All right. Katrina, do you have any questions of us?
Well, other than, do you need anything clarified while I'm still here? Did I answer everything that you were looking for? And when will you be looking to make your decision?
Okay, so I can go over that second part when making the decision. So we will be completing interviews today, tomorrow, and Thursday. And then on our special board meeting on June 9th, and then that's Thursday in the evening at 5:30 on June 9th, the Board of Health will be making selections. And then that will go to the Board of County Commissioners for final appointment. So, and that would be after that June 9th meeting.
Sure.
All right. Anything else? If not, thank you very much, Katrina. It was very nice to meet you and
I'm
to,
sure I'll be seeing a few of you around. Thank you so much, you guys, for the opportunity, and good luck picking a good candidate.
Thank you, Ms. Henkel, for managing both to be available for us in a volunteer capacity, but also for managing your parental responsibilities at the same time. You did it quite nicely.
I might have threatened her to stay quiet and there would be a reward later. Okay, maybe that's bribery.
I was gonna say
No,
that's bribery, and that is all, that's in the parent zone. We gotta do it.
That's fair, that's
The
fair.
world is soon. We're all used to having extra husbands snoring, kids rattling wrappers. I mean, it's just life. Well, thank you all. Have a great day.
Thank you. Enjoy your
Thank
day.
you, Katrina.
Hi,
thank you much.
Katrina.
Appreciate it.
Here.
Nice meeting you.
Yeah, nice meeting you.
All right, so our next interview is at 5 o'clock. Is everyone still planning on attending that one?
Yes.
Yes.
Okay,
I'll be there.
you'll be there. Okay, so what we'll do is we'll go ahead and list before that interview, we'll list what questions everyone will read, so everyone will know. So that we can add Nyla in.
Thank you.
Okay,
Good.
all right, we'll see everyone at 5.
Oh, and Ms. Duval, Ms. Duval, we're going to stay on the actual meeting. So if you would mute yourself, and then of course, if you wish to go off camera as well, because it's a full board meeting, we'll just pause. Thank you so much.
Okay. Is it okay if I sign off and then sign back in?
No, actually, we're remaining on since it's one meeting, and we're not actually having multiple meetings, public meetings. We're having one public meeting, so that's why we're just pausing, if it's possible for you.
Yep.
Thank you so much.
Hi, Ryan. Did you change the question schedule?
Yes, and Victoria is posting that right now in the chat.
Okay.
The first questions will be the same. It's the second questions, and then we'll add Nyla to the bottom. There we go. It's in the chat now.
Got it.
Victoria, is Kathryn in the waiting room?
Yes, she is.
Okay. Okay, so Kathryn Bambrick is the candidate for the other stakeholder position. If everyone's ready, is everyone ready and we can bring her on?
Ready.
You bet.
Okay. Hello, Kathy, are you there?
Yes, can you hear me?
Yes, we can. So do you prefer to be called Kathy? Oh, I think we lost her.
I think that's not her preference.
Show you.
I've always known her as Kathy.
Okay.
I mean, not that I know her that well, but yeah, but I do know her.
She's joining now.
Okay. All right. Well, hello again, Kathy.
Hello, sorry.
That's all right.
Working, and so I clicked out of my thing, and I clicked all the way out of everything, so.
No problem. Well, thank you for joining us this evening. I'm Ryan Eibach. I'm the Chief Operating Officer at the Yakima Health District. And we'll go ahead and go around the room and introduce ourselves. And then afterwards, if you want to introduce yourself and tell us a little bit about yourself. And then we have 11 questions to ask you. And then if you have any questions, feel free to ask us any questions that you have. So we'll start with our chair of the Board of Health is Commissioner Anderson.
Good evening, Kathy. Glad you could join us, and thank you very much for your interest in joining the Health Board. I'm Yakima County Commissioner, position 2.
Nice to meet you.
Hi, Kathy. I'm Patricia Byers, and I serve in the Yakima City Council, so I'm a city representative. And thank you for applying.
Thank you.
Hi, Kathy.
Hi.
Amanda Mckinney, Yakima County Commissioner for District 1. Wonderful to see you and very grateful for your willingness to serve on this board.
Oh, thank you.
Hello, Kathy.
Hi, I'm done.
Hey there. Good to see you.
I know.
Of course, you know, Yakima County Commissioner, District 3.
Yes.
Hey, thanks for applying. We appreciate your willingness to serve.
Thank you.
Hello, my name is Nyla Duvall. I'm a council member in Toppenish, and I serve as one of the city representatives representing all the cities in Yakima County. Thank you.
Nice to meet you.
Nice to meet you too.
And then we also have 2 members of the Yakima Health District that are also on this call. And so Andre and Victoria.
Yes, good evening, Ms. Bambrick. Andre Fresco, the Executive Director of the Yakima Health District. Thank you so much for joining us today and your interest. Appreciate it.
Thank you.
Hi, Kathy. My name is Victoria Reyes, and I'm the administrative assistant here.
Nice to meet you, Victoria. So
All right. Yeah, if you want to tell us a little bit about yourself.
Sure. So I'm currently the administrator of Astoria Toppenish Hospital here in Toppenish, Washington. And I don't know if you know much about Astoria Toppenish Hospital, but we are located on the indigenous land of the Yakma Nation. So we serve a very diverse population here. It's really, I think, a really great fit for me and what motivates me and doing work that I feel like is really making a difference every day. So I really appreciate my current position here in Yakima County. I also, but the other part of the Astoria Toppenish Hospital is we have a 14-bed behavioral health unit. So we're one of the largest behavioral health service provider in the county for inpatient services, probably in the region, if I were honest. And we're about to start construction to double the size of that behavioral health unit. So I feel like mental health is a strong program that I probably bring to the table as a community partner and representation. So that's what I'm currently doing. I know I've spent my whole career in rural healthcare and within Central Washington. So I've only worked in Yakima County and Kittitas County. So pretty much my entire career, Central Washington, and I've been in every aspect of healthcare, from social health service organizations, hospitals, clinics. I've managed an EMS program, urgent care, and obviously I've worked in public health. It's been a while, but I have worked in public health, so I have a pretty strong understanding of that. And I think it really kind of goes into that first question that you guys were going to ask me, is I really believe that rural health is, for me, it's just everything that motivates me personally. I really enjoy understanding a community, immersing myself in all the social and health service organizations, understanding the gaps and working together to solve them. And when you're in a rural community, you don't have as many resources. So for me, it's a challenge that I love and that I'm up for every day. But I believe probably Yakima Health District has that same challenge, where one organization can't solve all the problems. You need everybody to work together, and you gotta love that kind of work. It's a little bit messy, community work, but it's rewarding, and to make a difference is really rewarding for me. And I think the other part that I think is a good fit for me with the Yakima Health District is just that, again, just staying focused on what's most important. I love that community health assessment model and working together to meet the specific needs of the community. I think the health district does a really good job of laying that foundation for all of us. You provide all that data and the assessment, and if we use it, we all used it the way we should use it, we could solve a lot of the community problems together collectively. So that's something I think I could bring from at least the Toppenish area, is that engagement and getting our community more engaged with the health district. I also have strong ties with the Sunnyside Hospital, so we're a system. So I would bring that perspective as well.
Okay, and just want to verify that you did receive the questions yesterday?
Yes.
Perfect. Okay, thanks for all that information. And Commissioner Anderson will be the first one to ask a question.
Well, I think she pretty much answered the question,
Yeah.
but I'll read it anyway, just for the
Okay.
record. Share with us what you know about the Yakima Health District and what makes the mission of the Yakima Health District meaningful to you. I think you've already delineated that.
Well, I do, since I worked in public health, I do have a pretty good understanding of what you do, but not specifically, because I think each health district or health department has its own, you get funding, but you don't all focus exactly on the same work. But I'm very close and personal with environmental health programs. I really understand those. I started in public health and environmental health as a director, and then became the administrator of the health department. So that was my entry into public health. But I know that health assessment, community health assessments, are part of what you do: communicable disease prevention, health promotion, and education, from what I can see on your website. And of course, the vital statistics. But there's still some things on there that I hadn't heard of that I thought, why did I not know about this? It was the, what is that? I listed it as something I had to look more into for my hospital. I'll probably find, building resilient, inclusive communities. What is that? That's a good program. I haven't heard of that one. So I'm sure there's so much I can learn about your programs, but I do have that basic understanding, I think, of what you do.
Thank you.
Okay, Kathy, I have question 2. Do anybody need more time?
No.
Everybody okay? All right. So Kathy, in your opinion, what is public health and what is the role of the Board of Health member? And why are you interested in being on the board?
Well, I can tell you public health was one of my favorite jobs, favorite career stops. And I've been in healthcare for about 30 years. And, in public health, you never know what you're going to see. Every day is different, from, an animal bite to a pertussis outbreak to, a solid waste issue. You just never know what you're going to do. In public health, the other interesting part about public health is people don't really understand it. I saw that in some of in your strategic plan, that you still have that same struggle with helping people understand what public health is and how important it is. For everything it protects everything from the air we breathe to the water we drink, from just communicable disease prevention, the whole thing, that public health is just critical, it's vital. And people don't understand it until something goes wrong. If there's an outbreak of pertussis, I don't even want to talk about COVID. I can't even imagine being part of public health during this pandemic. I mean, I just can't imagine what you have all been through in the last couple of years. But anyway, it's just really important. Like I said, when public health is done well, people don't hear about us. And so that's the problem. You're out there protecting every day and people don't understand what you're doing. So, but for me, it's part of my passion. It's why I work in Toppenish. I feel like I can make a big difference. And I feel like with the Board of Health, and I don't know exactly what you're looking, usually when you're posting for a position, you kind of have the candidate you're looking for, that profile. So I don't know if I'll fit that for you, but I really thought it was worth applying and getting to know all of you a little bit better, because I should know you. I think I have emailed Ryan a few times. I thought about coming over and try to get to spend some time with you guys. So I apologize that I haven't done that yet, but this is a great opportunity for me to meet you either way. So I don't know exactly what you're looking for, and I feel like this was a worthwhile activity for me to participate in. But I really feel like that I could bring some skills to the table that you might be interested in. And well, I know that's part of your questions below, but it's essentially my passion for community health and participating in that planning for the community and making sure I help bring all my community partners on board to help achieve some of the goals that the health district has. And then I think you asked me about the role of the Board of Health member. And I think about this as an employee of the public health department. I feel like it's really to support the strategy for the health district, really understand that, advocate for public health, advocate for public funding. I think a lot about county code and ensuring that the code is in place so that you can do your work and enforce when you need to enforce, but also to have those rules and that code in place and you can do good work. But again, just being there for leadership. If I were being a good Board of Health member, I'd be out there for you, speaking to legislators or whatever you need me to do. You might not want me to do that, but whatever that support you need me to do, I would do that for you. And I am just trying to make sure that I was a good fit for whatever your priorities are, and just trying to align with that and then make sure I support it. But those are the big things that I was thinking about I would have wanted out of the Board of Health.
Thank you, Kathy.
Mm-hmm.
I'll wait for everyone to make eye contact before I move on. All right, question 3. What are some of your board leadership experiences, and what experiences do you have in following bylaws, statutory rules, and regulations?
Well, I've served on several different boards. I was on Elmview. I don't know if you're familiar with that organization. They serve the developmentally disabled population, which is really important to me. So I was on that board for 7 years. I was on the Ellensburg School District Education Foundation, because again, another passion of mine is education. It's really important to me as well. been on for fun, a little bit of fun, which you can call board fun. Gallery One Visual Arts Center. I love the arts. So spent some time on that board, about 5 years. So I think those were the big ones. Plus, I work for public health, obviously. That's why I understand a public entity and I understand all that that means, from understanding the RCW, the Washington Administrative Code, County Code, understand, obviously, I worked for Kittitas County Public Hospital District. So understand running a publicly elected official hospital structure, and really understanding and listening to the community when you work for a public entity, how important that is, that you engage with your community. Community relations is critical, and just engaging with your constituency, no matter who it is really important. So just understanding all of those things is really important. And I think working in for a public organization really helped me understand that to a great degree. I mean, I think about just the groundwater moratorium. I was at the public health department in Kittitas County when that happened. And all I did was community work. I was out there talking to the constituents. You know, overnight people didn't have water. It was horrible. But all of those things really teach you how to work with your community and just be open and transparent and honest about, you know, what's going on, and keeping that communication going and consistent is vital when you're work with a public entity. Hope I answered that question.
Thank you.
All right, Kathy, question 4. Walk us through the first 3 things you would do if you became a board member.
And that's easy for me. So my personal style is to listen first and to really understand. I don't come in with an agenda. I really want to figure out what my role is going to be. So I would meet with leadership to determine what those priorities are for me. Inherently, I believe my roles would be, I kind of think I know what they would be, so I'll tell you what I think they would be, but I would really look to you to help me with that. So just really understanding a strategic understanding of the health district, their priorities, their strategic plan, community health assessment data, really understanding where you guys are at and what's important to you right now. And then really become familiar with your messaging and your priorities, so I could be an advocate as soon as possible. So what are those things that you want me to say, and where are those places that you want me to interact with folks or other organizations, and really try to be an advocate as soon as possible for public health. But just trying again to get that deep understanding of what's going on and what's important is really, I think, the first step for me.
Thanks, Kathy.
Okay, that's me. What can you bring to the Board of Health, the Yakima Health District, and the community to make them better?
That is a really humbling question. When I was thinking about what am I going to bring, so I feel like there's things that I bring to the table just from my experience. I think passion, though, and I'm very passionate about public health, about the health of a community, and I am dedicated to it. And I'm probably the most persistent person you can ever meet. I never give up. I'm always looking for a way to make improvement and to make progress in the community. So I do bring that passion with me. But I think the other pieces on strategic planning and really being data driven, I definitely always start with my left brain and try to center before I start thinking about what I want to build or what I want to do. So I think I would bring that perspective. My background in public health, so coming in with an understanding, I think is an asset. Maybe it isn't, though. You might be looking for someone who doesn't know so much about public health as an asset. So I don't know for sure. And then just my healthcare career in Central Washington, I think I really have an understanding of the systems in the county, which gives me a perspective on maybe what's needed, some of the gaps that we have, and maybe that we don't even, maybe maybe blind spots that we have as well. I think those are the things.
Thank you.
Right. Looks like everybody's ready. What ideas do you have to make the Yakima Health District more effective and efficient?
And this was a really tough one for me. I was thinking about, gosh, that's a tough question. I think you might know more than I do. You read my resume, so you probably can see maybe things that you could tap into in my skill set. Again, I would watch and listen for the first several months, just because I want to make sure that I understand all of the strengths that you already have, and things that I could build upon. It's one of the things that I dislike is when people come on with a big agenda and don't take that time to really understand what's already in place. And again, you're a public entity. You don't need somebody coming in and with an agenda, because I think that would hurt you more than anything else. But I would say committed. I'm a very committed leader. So when I'm a part of a leadership team, I like to align with the team and make sure that I build those relationships so that we can be strong together. And I like very functional leadership teams, so that's going to be really important to me. So I think alignment, trying to really support the leadership so that ensure that we can advocate together collectively as a Board of Health team, I guess is the answer there. And everything I know about leadership is if we don't align, it affects everything. So coming in and trying to be cohesive is going to be really important to me.
Thank you.
Mhm.
Okay, all eyes on me. It's my turn, Kathy. This is question 7. On behalf of the health and the Yakima Health District, excuse me, on behalf of the Board of Health and the Yakima Health District, how will you build relationship and partnership now and in the future?
Well, like I said before, I feel like I need to really understand what that message is, and be clear on how I'm representing the health district. That's gonna be really important to me. I would rather say nothing or do nothing than to mess something up. So just know that's going to be really important to me. But I think once I'm clear on the direction and priority communication and my role, I would advocate for public health everywhere I could. I think that it's really important, and it's an important role of the Board of Health. So I would get community groups, school boards, districts, hospitals, obviously, city council, state, federal legislators. I would do whatever you guys need to really be your champion or one of your champions to ensure that we have success. And the other part of that is I'm already involved in community organizations. So I think I can just sort of drop this in to what I'm already doing. Obviously, I work through hospitals, so the Washington State Hospital Association. Sometimes those hospital relationships are important to you. Sometimes they're not. It just depends on if you're in a pandemic or what's going on in the community. But whatever I already have in place, I would gladly bring the health district into those different community groups that I participate in. But again, I'm willing to support you in any other way you would need me to.
Thank you, Kathy.
All right, I see Ladon looking up, so I'm going to take that as my cue to ask question 8. Since this is a citizen representative position, how would you represent the citizens of Yakima County?
So I feel like, I mean, this is really important. So I think this is part of why I was interested in the position. That voice of that community is really important in public health, really trying to represent. I know county commissioners, you do this every day. I know that that's a similar role, but I think that really, again, staying focused on that data, making sure that we're keeping track of what's going on in the community. We have access to data that is really important for prioritizing our work. But again, that voice, that community is going to be really important. I'm not sure when I say these things, so I'm not sure if I'm saying something that's too much work or causing anyone stress, but the more we engage with that community and more assessment we do, the more we're going to understand. But again, just getting out in the community and being available for the community to talk with a Board of Health member is something that I think that I could support and be a part of, and just trying to stay in the scope of my role here too. You probably already do some of these things, so don't think that I'm thinking that I'm going to bring in something different, but anything where we communicate to the community about what we're doing in public health is going to be really important to me. And I think we need to keep doing more of that, if not less. I know everything's been about COVID, but we need to do more and more of that communication about public health in as many ways as we possibly can so people can understand it. So I think I would do that as well. And then again, just anything, any community group or opportunity, I would like to take that opportunity to really interact with the community. So if you have events that you have planned, I would attend those. The fair, if there's a booth, I would attend and I would participate. I would always engage with that community in any opportunity that I have, if there isn't a formal way to do that. Again, through trying to get that voice of the community, because I think there's ways you can do that, and I would really want to advocate for that every day. So.
Thank you, Kathy.
Mm-hmm.
All right. Question 9, Kathy. What public health issues in Yakima County are you most interested in, and what is your vision for the health of the community?
Well, I obviously, I think just like everybody else here, I think I would, we want this community to be as healthy as possible and to put resources in place for them to stay as healthy as possible and to see progress. We want to see progress every day, every year, every decade. And with public health, it's hard to measure that, but that's our goal, right? Is for us to be as healthy as possible. So when I talk about what I'm passionate about, I think I'm really passionate about communicable disease prevention and environmental health. I think that holistic kind of piece that the public health brings to the table. And then that health prevention and promotion is just really important. I feel passionate about all those things. It's hard for me to choose. I just wanted to say why I love public health, but because I already love all of it. I don't know that you can just choose a piece of it and say, this is my favorite, when all of it is so needed and communities, all those things. So I'm pretty much interested in all of it and believe that, like I said, if we're doing it well, people don't even know that we're here. I mean, everything feels right and it feels good and everything's in place. So I have a hard time choosing the best or the area that I'm most passionate about.
All right, thanks, Kathy.
So, do you have any conflicts of interest or conflicting commitments that would prevent you from being a member of the board, voting on certain issues, or attending regular scheduled board meetings?
Not that I'm aware of. I can't think of anything.
Commissioner Anderson, I just wanted to recognize that looks like Dr. Atterbury has joined us.
Oh, thank you. Welcome, Doctor. I believe that was the last question. Kathy, do you have any questions for us, the board?
Just a few. I mean, not a lot, just a couple. Ideally, what are you looking for from the citizen representation position?
Would anyone like to answer that question? I think we're looking for, in my opinion, and others have their own views, but in my view, we're looking for a variety, a wide base of representation of population and knowledge, understanding, experience, because we can't just be narrow focused. We need to be we need to have a wide picture of what the board needs to serve and how we need to address things. So the more experience and the more diversity of knowledge and understanding and experience we can have, the better.
Kathy, I can talk about statutorily speaking, because the question as it was asked, the citizen representative, is from our old interview questions. These are citizen representatives, yes, but the reason why we're expanding our health board is due to recent legislation that passed, House Bill 1152. And the expansion of the health board has us adding more folks to the board. And specifically, you indicated that you were interested in, and I believe we verified that you are fit in the definition of stakeholder. So that's right. A little bit, we've got even more enhanced definitions. Yeah. So I wanted to make sure that there was that distinction there. So a stakeholder citizen representative would be someone, of course, who it's very broad. The terms are very broad, yes. But anyone who says that they have a stakeholder position in community public health, to which I would say that you are certainly would fall into that category.
Well, that's what I was thinking. By interview, the questions came with the citizen. I'm like, oh, I thought that so I just went with it. Yeah, that's fine. All right, so that takes away my questions. Then it sounds like it's a statutory requirement that you open this up for new representation
to expand the board.
Expanding, yeah.
To expand the board, yes. Okay.
And Kathy, I might add that from maybe not in your instance particularly, but for these positions in general, what we're trying to seek overall is a variety of experience and expertise.
Mm-hmm. Okay, and so that was really the second question I had was really about the strengths of the Board of Health and what you were trying to add to that. So is there anything specific that you're hoping to add, knowing that you had to do this requirement, but there might be some things that you were hoping to add to your
diversity in experiences.
Yes, and Ms. Bambrick, I just share also that the intent, as I understand it from the legislature, was the idea to allow, as Commissioner McKinney said, diversity of position, but also the representation of non-elected officials as well.
Okay. Well, those were my questions. I sort of going to change it up a little now that you gave me that nice explanation. So I really thank you for giving me an interview today. I really appreciated meeting all of you. And Ron, I hadn't gotten a chance to meet the third county commissioner, so it's nice to meet you as well, and staff. And thank you again for giving me this opportunity. And if I don't work with you on the Board of Health, I'm sure I'll work with you in some other capacity.
Thank you very much for your time, effort, and your willingness to step up.
Thank you, Kathy.
Here.
Thanks, Kathy. Kathy, appreciate your willingness to apply.
Thank you so much.
And I will see you again, Kathy.
I know you're going to. Yeah. Thank you.
All right. Well, thank you, Kathy.
Thank you.
Well, our agenda says that we do not have any new business. Is there a motion to adjourn?
Motion to adjourn until tomorrow's interviews.
I will second.
Been moved and seconded to adjourn until tomorrow's interviews. All those in favor?
Aye.
All those opposed? All right, we are adjourned. Thank you very much. I think it was a good first time out of the chute here.
Yes.
Very well, I think. Went very well. Thank you, Ryan and staff, others, for putting those questions together and the rotation of the questions, and it just went well. Thank you.
Victoria. woo.
Andre and Ryan, I'll be in touch with you if my schedule changes.
Or-
Yes, thank you so much. Have a wonderful
All right.
evening, everyone.
Thank
Take
Good
care.
night, everyone.
Be well.
Good
Good night.